Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and today's Monday, January 25th, 2021. It's time for our daily COVID update. As we went through the weekend, I finished on Friday, was kind of looking forward and looking to see where we're going numbers-wise. And, we kind of saw, was it a light at the end of the tunnel or was it a train? A lot of different things it could have been. Well, we think it was a light at the end of the tunnel. And as we've talked about with the vaccine and the continued social distancing and continued just the things that people in the community are doing to mitigate this curve, I think some things are working. Over the last few days, we have seen a decrease. And one of the things that we noticed here is on Saturday, we went below the 15% threshold for the first time. I think that's like a 14.8 or a 14.9 when you round up. That's the first time we've been below the 15% threshold since December 28th. And that 15% threshold is COVID patients in the hospital as a percent of total staff beds in the area. So we have 1,087 beds. Less than 15% of them had COVID patients on it. That's a good sign. And you can see as it went down those last few days. We look at Tyler. You can see the Tyler area, Service G, went down accordingly. So they're seeing that dip. Had the opportunity to meet with UT Health CEO on a call this morning at the Texas Hospital Association, and he talked about what's going on in the Tyler area. And I want to say he had 220 patients in their system 2 weeks ago, and they're down to 155 as of this morning. So they had seen that decrease as well. And then here's the Dallas region, and you look in there in Trauma Service E, and you can see they're right at there as well, continuing to go down. So as you can look at the numbers as a percent of staff beds, some good things going on. When you look at real hospitalized patients, I was hoping to get the numbers as of this morning that came out at 1 o'clock, and right before I came over, they weren't ready yet. So we're going with yesterday's numbers, and yesterday we saw that increase, down, and then boom, 177 on Saturday. So we'll see how it goes, and maybe that's just that one day, and we'll go back down to 150s and 160s. From a Titus perspective, we have today 20 COVID patients in the hospital as of lunchtime. And that's down. We were up at 26 last week at our peak of COVID patients. We have 15 on the floor and 5 in ICU, and only 1 in the emergency room being treated at this time for COVID-like symptoms. So from our perspective, it's a big sigh of relief to make it through this weekend and get to that point. So we're glad to see it. We're looking forward to this continuing to go down over the next few weeks. When you look at the Tyler region, you can see their numbers dropping accordingly. ICU patients have dropped, not as significantly as ours, but they've dropped a little bit from the 160s to the 140s. But you can see their number of patients over the last 2 weeks have gone down. And then from the Dallas region, a lot higher numbers, but you can see the same trend in the Dallas area. That same phone call this morning, one of the CEOs of one of the larger Dallas hospitals was on, and he was just talking about these numbers. You could just hear the relief in his voice. So this is, even though I'm speaking to my friends and family members in Northeast Texas, this is the same throughout the state. And this surge that started in November is a statewide surge. So glad to see it. We look forward to a continuing decrease in those numbers. As for the vaccine, as we go into the week 8 shipments, unfortunately, Titus will not receive shipments this week. We're disappointed in that, but we understand. I get disappointed we don't get shipments, but I look across the state, and we've received more vaccines, almost doubled and tripled than most of the rural hospitals in the state of Texas. We're sitting right now we've received 1,400 to Titus, and no rural hospital in Texas has received that many. So we are grateful. We're continuing to work with the state and the region and our legislative team. I appreciate Senator Hughes' office, what they're doing to help our team at the state level to try and do something in this area. So we are excited about that. But we'll finish our 400 today that we received from last week, and we'll have that many. So what do you do? How do you get on the list? I got a call from Miss Calendra, who I stay close to, about different things that happen around the city, and we've been friends for at least 15 years. I watched her kids grow up, and she's watched my kids. She called me. I was walking over here. How do I get on this list? So told her to watch the update today, but also just go to titusregional.com. You can see that COVID-19 waiting list. Click there. That's at least get your name on the list so we can at least start tracking you. As the state sends more, we can use this list. The 400 we received were pulled from this list that we just received. So get on the list, get your name there. If we're lucky enough to become something bigger, as far as vaccine, and we can go from maybe 100 or 200 to thousands a week, we'll look at this list and see how we can do it. But this is going to be the standard that we use. And so get your name out there so we can at least communicate with you, Put your cell phone, email. We need a way to contact you. It really needs to be a way to contact you automatically through email, through cell phone. So please get both those there so we can communicate back and forth. As far as donations and PPE, I am excited. I want to thank Dr. Menadeo's office last week. They did donate 2 big boxes of gowns. I don't talk a lot about PPE. That's a good thing. It means we're staying our course on PPE. It's not become something at risk lately. It's a little things here, a little things there. There's things we've never run out of before. In the 9 years I've been here at Titus now, we're running out of them just because we have so many ICU patients, so many patients on oxygen and vents and those things. So we're having to be a little creative. But the materials management team, and then also the PPE task force, Reese, you can see his picture there, and Chris Bell, and then Leanne in our lab and Ruth in our pharmacy. They're watching these items closely. So we're staying pretty good on PPE, but we appreciate Dr. Menadeo and his office for donating those 2 boxes of gowns. They will be used, and they are appreciative. As we talk about the numbers and we wrap up for this week, we had a meeting this morning at 12:30 with our medical staff. We have a task force of medical staff members who meet every Monday to review where we're at. What's next? We look at the number of patients we can handle. We can now handle 29 COVID patients at Titus. That's a lot for us. We've increased the rooms and the medical record to handle those 29 in rooms that they can be isolated in. But when you look at that and everything else, that meeting went well. One of the things we talked about, it wasn't really a myth, but just want to give you an update. We talked about the new strains that are coming out. There's the strain that's from the UK. There's a strain from the South African strain that is more severe. Our physicians are up to speed on all that information, and they were able to work with our clinical team and our nurse leadership to talk about those different strains. And we do have the Moderna vaccine, which is what we've had so far. We do hope that's the one we continue to get. It seems like that's been the one that works the best versus some of these strains. The Moderna already said that they handle the UK strain, and then just an hour before that meeting this morning, there was something I want to say it was the Washington or New York Times. One of them posted an article that Moderna had stated they are being able to handle the South African strain as well. So those are the things that our medical staff are looking at on a daily basis, and I can't thank them enough because they're asking the questions and representing this community. So when you see your doctors or go visit your doctor, you see them around in Walmart or at church or just around town, just tell them thank you and for what they're doing for our community to make sure that we're bringing the information on a daily basis to help this community get through this pandemic and this crisis. I can not say much words thank you. It's just been so grateful to our medical staff and our clinical team for all the work. We'll continue to do these updates. Even the numbers are going down. I'm not going to stop doing this. Monday, Wednesday, Friday. Friday will be a little different time this week, but we'll continue to do these updates until we're at a point where people don't care anymore. And right now, we're going to continue to stay the course. We're going to continue to wear our mask. We're going to continue to social distance, wash our hands, and do everything possible to mitigate the spread of this disease. And this is horrible. This is just a bad thing that's going on in our community, and we're going to continue to work and do everything we can to protect Northeast Texas. Thank you for your support. God bless.